Yeah, so a lumpectomy is basically a surgical procedure done on the breast to help us remove any abnormal tissue or cancer. It is usually in conjunction with other treatment options for early stage breast cancer. When a lumpectomy is performed, one of the other treatment options is usually radiation. And in conjunction with the lumpectomy and radiation, this really reduces the chances of the cancer returning. A lot of patients want to know about the procedure in detail, and it usually involves making an incision on the breast and then removing any abnormal tissue along with a little bit of normal healthy breast tissue to make sure that we're getting all the concerning tissue out of the breast. This is also known as breast conservation surgery. It is done with radiation to treat breast cancer. Studies also show that when we do breast conservation treatment, compared to a mastectomy, the long-term outcomes are about the same. So this is a good option for early stage breast cancer to perform a lumpectomy in combination with radiation. A lot of times when we detect breast cancer early, it is not something that is palpable to the patient or to the surgeon. However, we do need to remove the area in the breast tissue that is concerning. So at the time of surgery, we use the help of our radiology colleagues to either place a small wire or some kind of clip or tracer that we can detect at the time of surgery to help guide us in the direction we need to go to remove the concerning tissue. So typically, a lumpectomy procedure can take, depending on the size, location, and whether lymph nodes are biopsied, about an hour to an hour and a half. Afterwards, you're discharged home. Your recovery time is roughly 5 to 7 days. Minimal pain. Patients are able to get back to their normal lifestyle relatively quickly. There'll be follow-up in the office just to confirm that all the tissue we intended to remove was removed. And then follow-up with oncology is usually afterwards to make sure that there isn't any other treatments necessary, including radiation. For early stage breast cancer, this can be stage 1 or stage 2. A lumpectomy is a wonderful option. Again, we call this breast conservation treatment. It's usually a twofold treatment. Surgery is usually done first, and that is followed by radiation. And we offer this as an option because it tends to lend well to less scarring. And the alternative is that a mastectomy was performed. And we now know that studies are showing that a lumpectomy with radiation is as equally effective in decreasing recurrence rates of breast cancer as was performing a mastectomy. So this is a wonderful treatment option that we can provide to patients with early stage breast cancer. With a lumpectomy, there's another procedure that we do at the time for patients with early stage breast cancer, and that is to sample a lymph node. So it's usually done in the armpit. We use special tracers that are injected prior to surgery that we can detect to help us locate the first draining lymph node in the armpit. That's generally where the breast tissue drains lymphatics. And if you do have breast cancer, we would want to know if there are any signs of spreading. And usually the first signs go to the lymph nodes. So at the time of surgery, we typically will biopsy one of your lymph nodes when we're doing a lumpectomy. Outcomes with breast conservation treatment are excellent. They rival mastectomies when it comes to cancer recurrence. Patients like the quick return to feeling normal and back to work. There's less scarring, there's less pain. The other thing that's really important to discuss is the cosmetics. With a mastectomy, the whole breast is removed, whereas with a lumpectomy, only a small portion of the breast is removed. And oftentimes we're able to maintain contour and shape of the breast with minimal scarring, which is a very optimal outcome for a lot of our patients.